Hello and welcome to QOF 400 screencast. In this episode, we will be discussing chronic kidney disease management template. As you can see, it is highlighted right here. I'm going to go ahead and apply this template to this particular test patient. By launching this template, you will see by now the familiar look of our templates. Here you can see that the template relates only to CKD levels 3 through 5, which is what the QOF system focuses on. As a result, by identifying the stage appropriate to your patient, you can go ahead and choose it. Assuming that you do not recall the exact differentiation between those different stages, we have added this particular tab here that will help you identify the particular stage of failure based on the appropriate EGFR. As you can see here, this here tells you the differentiation between stages 3A and 3B. Once you've decided on the choice appropriate for your patient, you can go ahead, as we said, and apply that to it. Of course, we all know about the association between chronic kidney disease and hypertension. As a result, this particular section here has been added so that you can remember to code your person with hypertension if they are not known to be hypertensive as such. And you can go ahead and apply the blood pressure measurement to their record, and as soon as you do that, this then will be added at a later date to this particular section here. If you have the ability to add their ACR or PCR, you can go ahead and do that. Otherwise, they can be added at a later date. As a result of the nice guidelines reminding you how to manage your CKD patients, it recommends, for example, initiating this person on an ACE inhibitor, and therefore this particular section has been added here so you can choose the appropriate ACE inhibitor to apply to your patient. I'm just going to go ahead and choose 2.5 milligram of ramipril, like that. If, on the other hand, this person is, say, not appropriate for the choice of an ACE inhibitor, I can then choose another such inhibitor, such as the ARB, let's say candesartan, at 8 milligram, in which case I can just go ahead and remove that code from here. So I'm just now down to candesartan. If this person is already on an ACE inhibitor or an ARB, you will see that this particular information is displayed here. Otherwise, it will not, and you can then go ahead and apply it. Additionally, QOF reminds you of the relationship between smoking and deterioration of chronic kidney disease, and as a reminder for that, you now have this section here to say this person is a smoker, and you've also advised them on smoking cessation. You can elaborate further on your advice by adding further textual details to this particular advice. Now that you've established these results, you can go ahead and move to the contraindications or exceptions if there are any. These have been simplified dramatically to avoid any confusion. I hope this was a useful reminder about the management of chronic kidney disease using our own template. Thank you.